Let's have a look at contraceptives. This video will give you a clear, quick view of the types of contraceptives, the contraindications, and the side effects. The first is the barrier method. Most common is the condom. You get a male version and a female version. Then the diaphragm, which is the cervical cap, and lastly family planning, which involves planning intercourse according to the menstrual cycle. Contraindications are slim for barrier methods, and the main one would be latex allergy. Next, the combined method. This includes the combined oral contraceptive pill, also known as COC pill. It is a combination of estrogen and progesterone. The patient takes 21 days of the pill and 7 days of placebo. Then, the patch is an option, and this is kept for 7 days at a time. Lastly, you get what is called a vaginal ring. The contraindications for combined methods are an easy mnemonic. Vitamins make boys sleep better hours. V for venous thromboembolism risk. M for migraines with an aura. B for BMI over 30. S for if they're a smoker and ex-smoker. B for if they've had breast cancer or have a family history of breast cancer. And lastly, H for hypertension. So vitamins make boys sleep better hours. Side effects to remember and mention to the patient are breakthrough bleeds, breast tenderness, hypertension, nausea, and bloating. Next, let's look at progesterone-only methods. These are usually used when there's a contraindication to COC. So if they have a VTE risk or if they have migraines with an aura. The options include the progesterone-only pill, also known as the mini pill, and is taken daily. Injections. In the UK they have depo-provera and is given at 3 weeks intervals. Implants, called the Implanon, and is inserted every 3 years. The contraindications are if you are pregnant, you have breast cancer or a family history of breast cancer, or liver disease. And the side effects include acne, weight gain, mood changes, decreased libido, and irregular periods. The following option is simple. It's called the coil. You get hormonal, which is the Mirena, and it can be kept for 5 years and is the contraception of choice in the UK for those over 20. They do have to be able to check the threads though. Then the other option is the copper T. This can last for 10 years, and the main contraindication is that you cannot have these inserted if you have an active sexually transmitted infection or if you are at a high risk of an STI. The side effects are related to the insertion of the device and include damage to the surrounding areas or infection. Then lastly, permanent options include a vasectomy for males and hysterectomy for females. It is important to be sure that the patient has completed their family, as this is an irreversible option. So to recap, the easiest and most applicable thing to remember for the exams is the contraindications. If they have migraine with aura, then no to COC and yes to POP. If they have a VTE risk, then no to COC and yes to the mini pill, also known as POP. And if they have an active STI or they are at higher risk of having STIs, then it's no to the coil, and implants are not a good idea. I trust this video has given you a better and succinct understanding of the contraceptions available in the UK and what to know for the exam. For more information on how to choose the right contraception, then click on the links in this video or down below.